We also have fractional RF remodeling called the Morpheus. Most of you have the Morpheus. All of you should have the Morpheus. It's the single most deployed energy-based device ever made. In the past 3 or 4 years, it has dominated the energy space. 4 million Botox treatments in 23 and 24, about 2.2 million filler treatments, 1.3 million Morpheus treatments, one done every 23 seconds, because it works. And so the Morpheus is now FDA cleared and approved for soft tissue contraction. What you get on the Optimus Max is the Morpheus Burst family, which is different than the older Morpheus, and let's review what that is. And so the Morpheus8 is going to be deployed for texture, wrinkle reduction, pore improvement, acne scar improvement, for laxity, dermal remodeling, and tightening using FSN as retention, ligamentous, deep fat contraction, and contour reduction. You can kill fat and reduce localized fat. You've got the M24, the M40, and the M12. The 12 is periocular prime. Nothing has changed with the periocular prime. The M24 and the M40 are different. And so let's take a look at how this very versatile product on the Optimus Max can improve your business and your patient outcomes. And so hold up the M24 if you can, please, Shelby. And this is the M24, still a black handpiece. And so that is the, get it into the screen, the M24. So let's put the real tip on there, not the protective plastic one. It has 24 gold-plated electrodes, uncoated 500 microns at the tip. It creates monopolar ablation, zones of red and orange. That's pulse duration controlled, not temperature controlled. RF flows to the negative electrodes on the skin. So it's tip to skin. Most other RF microneedlers, virtually all in the US, are tip to tip. The ablative index is much smaller, it's more comfortable, but it don't kill fat. It doesn't treat the FSN. Those are dermal remodeling, which is important, but you get dermal remodeling with the Morpheus. You also get fat destruction and FSN contraction. And so you can see the positive electrodes that now go down to 5 millimeters, not just 4. And now you get a burst and a scale, we'll talk about scale, on the M24. So you get 2 passes in 1 treatment. So it goes deeper and it's faster because you can get a double burst, which you didn't used to be able to get. And so let's go ahead and treat the neck with a 4-3 and 3-2 burst. We don't need to worry about scale. I'll tell you when I use scale and what the difference is. And let's go both sides now, PowerPoint, and let's talk about the M24 burst and scale. Goes to 5 millimeters. The M40 still goes to 7, but you get burst and scale, not just burst, and it can be triple. So the M40 gives you 3 layers at once, burst or scale. The M24 gives you 2 layers at once, burst or scale. So let's talk about what burst is. Burst is the same amount of energy at each level. So you get up to 30 of energy for the red, which is ablation. Just vaporizes the fat in the FSN. Then you get the zone of orange, which is coagulation, non-ablative apoptosis, fat destruction, FSN contraction. But at burst, you get the same energy at each level. With the M40, you get 3 levels. With the M24, 2 levels. Scale is more energy deep and less energy superficial. So scale, I deploy when I'm kind of worried about the skin. When would I be worried about the skin? Think about it. Elderly, thin, compromised, autoimmune, diabetic, or skin type 4 and 5.